Tonight we're having a community forum on healthcare reform. It's an opportunity for people to come in and ask questions from the real stakeholders in the healthcare reform debate.
So when we talk about, end-of-life care, part of the discussion and how we deal with some of those issues are maybe making known to people who care about us what it is we want done, and in that sense.
We have everyone from representatives from seniors to doctors to nurses to even health insurance here on a panel with the idea that people haven't really had an opportunity to ask good questions and get neutral answers or answers based on the real impact that we're going to see in the healthcare system.
How many of you are scared because you think that a public option means the government's going to take over and that's the worst possible thing that could ever happen? 2 hands back there, okay.
Everyone has their personal stories, and that's one of the things we wanted to get out to the community about coming tonight, is that if you have any questions about are you going to be covered, what's going on in DC, how is it going to affect Nevadans, and how is it going to affect you personally?
Name me one thing other than military defense that the government does well. Can't even deliver the mail.
When we talk about the reform, how does the mental health and health care of my insurance company is up against what the government or other entities may bring to people who do not have this?
If you folks leave with nothing else this evening, I want to tell you healthcare is big business.
I think that the public has to be involved. I'm very big on government accountability.
What happens when you have an individual who is fairly healthy and then you have a disease that comes on that's basically idiopathic, but because it's rare, there's really nothing out there but what's being created for other illnesses.
If you're a drug company, you say you don't want to develop drugs for diseases that aren't a lot of people of because you won't make a lot of money. So what the government has done is to extend that. That's Orphan Drug Act. That would be the best way to answer your question.
Go ahead.
Everyone was able to get their different points of view across, and I think that that's important to not just have one person's or one group's point of view, that we can all come together and get a compromise, because I think that's what it'll come down to, is compromise.
It's very tricky because we're looking at how much we're spending to fix a lot of the problems, but then hopefully when we make the facts